You're finally on Ozempic, Wegovy, and losing weight, controlling your blood sugar, feeling like a success story in the making. But there's just one problem. Your thyroid meds aren't working like they used to. Your antidepressants feel off, and suddenly your birth control, questionable at best. Could your life-saving daily medication become ineffective just because your stomach empties a little bit slower? Welcome to the surprising side effects of GLP-1 drugs, the very same medications that are revolutionizing weight loss and diabetes management might also be interfering with your everyday pills. But how? And should you be worried? In this video, we're diving deep into how GLP-1 drugs like Ozempic, Wegovy, Mounjaro, and Zepbound affect oral medication's effectiveness. We'll explain what really happens when your stomach starts taking its sweet time to process anything that you swallow. And, more important, what meds you should never take casually when you're on a GLP-1 medication. Spoiler alert, it's not just birth control and thyroid meds. Your antidepressants, heart medications, seizure meds, and even your painkillers might be absorbed differently or not at all. But don't worry, this isn't a scare video. This is an info-packed guide to help you work with your doctor and your pharmacist to protect your health while maximizing the benefits of your GLP-1 journey. So, if you or someone you love is taking a GLP-1 medication and wondering why your pills are suddenly acting weird, this is for you. Let's break it down. What GLP-1 drugs do to your digestive system. Let's start with the basic. GLP-1 stands for glucagon-like peptide 1. It's a hormone that your body naturally produces in response to eating. One of the most powerful actions, it slows down how fast your stomach empties into your intestines. This is known as delayed gastric emptying. When you take GLP-1 medications like semaglutide, Ozempic, Wegovy, or tirzepatide, Mounjaro, Zepbound, they amplify this effect significantly. Your stomach doesn't just slow down. It goes from a well-oiled machine to something closer to a bottleneck. Food and any pills that you take now hang out longer than expected. This slowing down is actually part of the reason why GLP-1s help with weight loss and blood sugar. When food lingers in your stomach, you feel fuller longer. Blood sugar spikes are smoothed out. Insulin gets released in a more controlled fashion. That's all good, unless you're depending on the fast absorption of a medication. See, most oral medications are designed to be absorbed at most medications are designed to be absorbed at very specific points in your digestive tract. Some are absorbed in the stomach, others in the small intestine. If the pill just sits in your stomach, especially for hours, its effectiveness could change drastically. And in some cases, the drug may still be absorbed eventually, just later than expected. In other cases, the pill may never reach the part of the digestive system where it is meant to be absorbed. And in worst case scenarios, you could end up with no therapeutic effects at all. This phenomenon mimics a condition called gastroparesis, which is literally a paralyzation of the stomach. While GLP-1 induces gastroparesis and is typically reversible and dose-dependent, it still creates the window of time where medications could be delayed or disrupted. And for some people taking life-saving and time-sensitive meds, this delay could be dangerous. The science of drug absorption. Let's nerd out for a minute on how drug absorption actually works. When you swallow a pill, it starts to dissolve in your stomach, but here's the twist. That's not always where absorption happens. In fact, many medications are absorbed in the small intestine. The stomach is basically a holding tank. Once the stomach pushes its contents into the small intestines, the body gets to work pulling the drug into the bloodstream. This process is called gastric emptying. If it's delayed, your pill just sits there, and that affects a few key things: how fast the drug starts working, peak, how much of the drug is absorbed in your bloodstream at its highest point, the duration, how long the drug stays effective. Now, if a drug is delayed but still eventually absorbed fully, you might just feel like it kicks in a little bit later. But if it degrades in the stomach acid environment, or if the body isn't absorbing it properly, you may get a lower concentration than what is needed, or none at all. This could get dangerous. Some meds need to hit a specific level in your blood to be therapeutic. If they don't get there, they're ineffective. Worse, if your body tries to absorb too much all at the same time or delayed, it could be toxic. Now, imagine this playing out daily with multiple medications. You could see how GLP-1 induced delayed gastric emptying can turn into a pharmaceutical nightmare. So let's talk about specifics. Medications most effective. Which pills are the most at risk? Let's break it down. Thyroid medications. They need to be taken on an empty stomach. Delayed emptying throws off the absorption window. Too little equals fatigue, weight gain, depression. Birth control pills. Estrogen-based oral contraceptives rely on steady absorption. Studies suggest that it may be less effective if absorption is altered. Consider switching to a non-oral contraceptive like the patch or an IUD. Painkillers like Tylenol, ibuprofen, etc. Delayed absorption equals delayed release. Risk of toxicity if the drug pools and is released all at once. Seizure medication, critical to maintain stable blood levels. Delayed absorption can trigger seizures. Antidepressants, inconsistent blood levels can worsen mood swings, anxiety, and suicidal tendencies. Blood pressure medications and heart medications like beta blockers and calcium channel blockers. Timing is crucial to avoid blood pressure spikes and arrhythmias. Oral diabetes medication could affect blood sugar control. Risk of hypo or hyperglycemia depending on what time you take the medication. Immunosuppressants, like for transplant patients. Narrow therapeutic window delays could mean rejection risks. Each of these categories has meds that could be seriously impacted. That's why every patient on a GLP-1 medication should go over their full medication review with their doctor. Timing is everything. So how do you work around it? You may need to rethink timing of your medications. For example, thyroid meds. Take them at least 4 hours apart from your GLP-1 dose. Birth control. Don't take it with food. Consider backup contraceptives. Pain meds. Take with a snack, but not too soon after your GLP-1 shot. Mental health meds. Take at the same time daily, preferably when the stomach is least full. Also, consider switching to formulations that bypass the gut. There's patches, there's injections, there's sublingual tablets, nasal sprays. The fewer variables between your medication and your bloodstream, the better. Medications that could be dangerous. Some drugs aren't just less effective, they're potentially dangerous when delayed. Warfarin, which is a blood thinner. Delayed absorption could lead to clotting or bleeding. Lithium, extremely sensitive to blood levels. Mood stabilizers, Delayed absorption can cause emotional instability or withdrawal effects. If you're on any of these, you must consult with your doctor before continuing GLP-1s, period. What the FDA and research says. Let's talk data. The Ozempic label clearly warns us about delayed gastric emptying. The Mounjaro label also mentions changes in how oral meds are absorbed. In clinical studies, metformin is still effective, just a little bit slower. Thyroid hormones, blood levels, they've dropped off in some users. Oral contraceptives, efficiency is questionable, especially in early use. Still, much is unknown about GLP-1 and the relatively new mass use. Long-term studies are underway. Until then, caution is critical. What you should never do. Let's get blunt. Never crush or chew tablets without medical advice. Don't take all of your pills at once just to get it over with. Don't skip pills if you're nauseated. Ask your doctor. Don't assume it's all in your head. If you stop your medications, obviously they're not going to work. Listen to your body. If you feel different since you've started a GLP-1 medication, there's a reason. Real-world doctor and pharmacist tips. Doctors are now recommending review your full medication list when starting a GLP-1. Blood tests should be taken to confirm absorption when needed. A tracking system and a journal, your timing. Switching to non-oral forms when possible. Splitting doses if approved to ease digestive stress. Pharmacists may also recommend extended release versions of certain medications, liquid or dissolvable alternative, spacing out your meds through the day. Teamwork between you and your doctor and your pharmacist is everything. When to panic versus when to adjust. Red flags as to when to call your doctor. New fatigue, irregular heartbeats, worsening depression or anxiety, unexpected pregnancy, seizures, blood sugar swings, mild delay in onset, may be fine. Misabsorption altogether, dangerous. Keep a log. Be proactive. So let's wrap this up. GLP-1 medications are powerful. They help with weight loss, blood sugar control, and even heart health, but they also dramatically slow down how your stomach empties, and that can mess up with how your body absorbs certain oral medications, from thyroid meds to birth control to antidepressants. Nothing is safe from slow motion stomach effect, but knowledge is power. You don't have to choose between your GLP-1 medication and other medications. You just have to adjust how you take them. So talk to your doctor, talk to your pharmacist, ask questions, bring up every single pill you take, even supplements. And if you found this helpful, drop a comment about your experience, and don't forget to hit that subscribe and like button. Share if you know anybody else on this medication, and stay safe. For our contest today, we're going to use a guitar. If you're a subscriber and you hit the like button and you comment the word or the emoji guitar, you are entered to win a gift card. And have a good day.